scary and they kind of need to kind of be wary. So we need to, you like that? Every now and then.
Over here.
Every now and then. Some rappers might be listening.
Yeah, you might get signed up by a producer.
I know, they might steal some of my lines.
Can you say that again? What was that?
I don't know. They're wary. If they think it's scary, they might be wary.
Oh, that's good.
Quite contrary.
G'day guys, Aaron and Ninja here from MMT. Today we're going to be talking about the Quadratus Lumborum. So this muscle here, deep in your lower back. It's so deep that it's actually categorized as being on the front side of your body, which is pretty cool, isn't it?
That's deep.
That's pretty deep. That's all the way through to China, isn't it?
Yeah,
So this is the reason why we're doing this video is one of our students, Cheyenne, has wanted to see some kind of in-detailed QL work, Quadratus Lumborum work, and we thought, why don't we do a bloody video together for YouTube, hey?
Maybe YouTube.
How good, like look at this muscle. Like that's the spine, that's the pelvis, and that's the 12th rib. So it's like in that space, and it's very commonly implicated with lower back pain. So people that have lower back pain, this muscle is generally really tight, angry, painful, spasmodic to kind of protect what's going on here. And we just love this picture because just look at it, the detail. Like it's trippy, isn't it, Ninj? There's muscles and directions and fibers going in all sorts of areas here. And you can see how it attaches to every part of the lumbar vertebrae, the top of the pelvis there, and the 12th rib. So when that gets really tight, you can imagine it's going to close up all that space and cause issues with range of motion and mobility and just freedom. And some other examples here. So we can see here without the other things involved, just its location there. And then over to this side too. But we just love just the detail and the complexity of it all. But I guess just to talk about its function, I guess. So it's a very powerful stabilizer of the core here, of the lower back. So it plays a very important role in, I guess, the stronger we are through here, the stronger our peripheries, our legs and our arms are going to be able to function as well. It's often called the hip hike muscle because when it gets tight, like if one side's tight, you're going to have this hiking effect, and that's where people can feel like they start to shift to one side and they just feel a little bit off center. So if you've got that feeling of not being kind of symmetrical or something, or things feel clunky, this muscle can often be involved, or one of them is tight. You know, when one's tight and one's loose, you're going to get that real side bending feeling. When both are really locked on tight, you're probably going to feel more of like an anterior tilt and just like a real compressed lower back, okay? So that's why treating it can be so amazing because, it can give you freedom. It can obviously take away pain, but it can make you feel more mobile and just unlock your movement. So we just wanted to do a little case study on it today on how we treat it. And Ninja's going to show some really cool dynamic treatment where you can actually treat people when you don't have a table. You can just get them in the positions that they're feeling their pain. And then we're going to show you some regulation treatment as well. Just before we move on, maybe just let's have a look at some of the referral patterns. So you can see here some pretty key areas of referral. So right at the sacrum, right at the bottom glute, and then you've also got some kind of greater trochanter, head of the femur issues there too. Kind of refers out into where the glute med is and even comes around to the front. So if you've got kind of nagging pain in your hip, then the QL probably is something you want to look at, okay? So yeah, this is probably a cool example too of just the hip hike. So we can see how when it gets really short here, you're going to have like a bit of a scoliotic curve in the spine. You're going to have like a leg length discrepancy. And then when we restore length, you can see how it restores symmetry. So a lot of people they say, I've got scoliosis, I've got a leg length discrepancy, but it can be functional, meaning it's caused by the muscles rather than skeletal, which is kind of a bit more permanent. But either way, humans are pretty resilient and you find a way. Usain Bolt has a structural scoliotic curve and it doesn't stop him from being amazing too. So it's kind of not an excuse at the same time as well. True. All right, Ninj, what do you want me, brother?
All right, so what I'm going to do is, from the information we got, the person was feeling like they had problems right next to their spine, but they had a kind of, someone assessed it and said it was like the QL. So what I want to do is just the way that I would go about it. So I'd get the person, which is Aaron, to move around and try and replicate your pain. It doesn't have to be any kind of special
Maybe
test.
I've actually got something for you or something.
Yeah, maybe you do. So you can kind of get them to do a test where you can feel it's tired or something like that.
Something, yeah.
Something there. So just face that way. Just maybe sit down and see if you can replicate your pain. Tell me where there's a tight spot.
Yeah, there's something.
So in there.
Yeah, like probably high up in there.
High up in there.
So, yeah.
So just with that information, what we can do is I can kind of push into there. So I might just grab Aaron, grab his, might come down here for a start. So I'll get a purchase and I can push up into here.
Oh yeah.
Like that. So that's probably getting some QL, the bottom of that rib. So I would just sort of go with that information and push into there like that. And then, yeah, let Aaron kind of use me as a tool and you can kind of just bend back into me. It'll soften it. So that's quite often where you're gonna really get engaged with that tissue and hold on to it till it melts. So yeah, by moving around, it helps me access different little aspects where it could be glued on, you know, adhesive, scarred in this area, and it's not allowing that tendon to be able to express the way it should be able to. So there.
That's
Like
on
that.
it, man.
Yeah.
That's really good.
So you can get flush on it right from the start. So very little assessment needed, time taken, but yeah, you can get right into fixing this up. So it might not need like an hour of actual manual therapy and then kind of it just be hoping that it's all kind of being cleared out at the end. You can kind of get right onto it from the start. So I'm just holding onto that. So see how I've just sort of haven't tried to be busy. All I'm trying to do is really engage with that site in that body where it's locked up and painful like that. I think in the case study, it's been 14 months of was it an accident or something? Or,
I don't know, but yeah, 14 months of pain.
So
it's chronic by now. So yeah, we were keen for our student to just get stuck into it because chronic stuff is our bread and butter. We love it.
Yeah. So I can kind of come out there. You can see there's a big red thumbprint in there. How's that feel now?
It feels a lot better actually, man.
Yeah.
Honestly, it does. It kind of felt like you were really right up into those, get our mate Bonesy here. Yeah. So we kind of remember the QL attached to the bottom rib here, Puppley's rib down the top of the pelvis, and then these transverse processes of the lumbar spine. Felt like Ninja was really just pushing straight up into one of those attachment sites. So that felt really, really good. Because just to kind of reiterate again, like see how they attach right into those points there. So I felt like Ninja was mobilizing one of those, which was awesome.
So that's probably a good point because the person was saying that it feels like it's my spine. So the QL does actually attach onto the spine. So they could be right.
Could be right.
They both could be right.
Yeah,
you know what I mean?
physio and client.
Yeah. So I'll just sit you down again.
Yeah.
So, but say if they kind of said that it was, in closer to the spine, what we could do is I could try and go in here like that and I could push in close. So I'm getting into like these little muscles in between. So I'm going to try to push through erectors and stuff, but I'm close to the spine. So then I can kind of hit into those rotatories and your multifidus.
Yeah.
I just learnt those last week. So,
mate, they've been your favourite muscle for 10 years.
I know. I love them.
Oh, that's good there. I like that.
So see how I can kind of guide Aaron so I can soften it and then I can push right in. So I could probably be working those attachments of the QRs as well on those transverse processes, those lateral wings of the spine, and hit right onto it. So you're just sort of trying to get in, and the most important thing is you got to connect, engage with the block and work it until it's softened, really. Just as simple as that. So if it is in closer to the spine, that's where you go. So it's just simple as that. But you got to have some strong thumbs to be able to get that to happen.
To do that.
So yeah, elbows into that and trying to do this, it's probably not going to work. So yeah, anyway, jump on the table, please, man.
Start with the show and then give them the regulation.
Yeah, now we just get back to the normal kind of proceedings. So a little bit of wax. So we can kind of, on the table, probably don't need any wax, but we can kind of get in underneath the ribs. And so where that's attaching on underneath there, we can kind of hit in under there engage with it, hold on to it, like that. And so to give Aaron time to receive it, you know, we don't want the flight or fight thing to happen. We don't want them to try and run away or fight us out. We want them to kind of know that it's safe. Even though it is painful, it's safe, and we're not going to go fast. We're not going to do anything that's really fast and scary, and they kind of need to kind of be wary. So we need to, you like that? Every now and then,
over here.
every now and then, some rappers might be listening.
Yeah, you might get signed up by a producer.
I know, they might steal some of my lines.
Can you say that again? What was that?
I don't know. They're wary.
If
they think it's scary, they might be wary.
Oh, that's good.
Quite contrary.
Oh, ninja.
How's that?
Yep.
Mary.
Oh.
So yeah, so you can kind of get in underneath these sort of spots and just really clear it, so it can kind of come out a bit wider under there, and so we can kind of dig in.
Oh, that's good.
And hit that those deeper layers, because we've got to remember it's underneath the erectors.
Yeah.
You know, the lat is a big, you know, the superficial muscle, latissimus dorsi. It's connecting right in lower back, but that superficial, it's really white through the lat as well. So it is, when it's white, it means it's more like rubber than the red bit on the chart is the muscle, which is more soft and more blood flow and things like that. So when it's more rubbery, the tissue is more dense, and the function of it's got to be really strong, so it can, you know, bear lots of forces and loads and things over a lifetime. So wherever we're performing whatever we're doing in our life. So yeah, there's like a thumb kind of thing up into there. You can see some good thumbprints in there, but we can kind of get elbow in there as well. So I just take the slack out of Aaron's skin, so I can kind of bear up and under like that. So I can get right in and under. So I suppose the beauty of doing the dynamic stuff we did at the start is like we can hit different aspects of the muscle while the range of motion is happening. And so different aspects of a tendon, say, if it is that a particular tendon or particular site, can be, you know, hit, engaged with, and then it can be cleared, melted and things like that. So that's kind of the whole game, is to actually hit the adhesive parts and melt them down, you know, file the rust off, clear the pathway type of thing, so the body can heal itself. Basic as that. Like, we want to get all the dead cells, the damaged cells out, all that built up calcium from over scarring and things. So we want to clear that out, let the body take that care of that, and then we need to let fresh blood flush in, you know, to that site that's softened up. It's more flow, more blood can flow through it, more movement can happen. It can squish and stretch. Real basic. For movement to occur, we need squish and stretch. So like that. So that's the. So, and if I go around the other side, I can do like a traditional money spot kind of work, but then go around the hip. So just pull that down just a fraction. So I can kind of take the slack out of the skin and bear into that money spot region. But you can see part of the QL does kind of go down into this bit here, attaches onto sacrum. I think that's right.
Yeah, good work.
Yeah, I think if I remember looking at the diagram just before. So we sort of start here, but we're not kind of interested in the money spot so much for this video. So I'm going to just start to bear out and trace along that sacrum, like that. And then really explore where it's sort of stuck on these spots in here. So I kind of, this is the secondary money spot, is where QL attaches on through here. So all we're going to do is really bear into that, explore angles, so I can kind of just angle forces into different spots. and just wait. Just wait on it. Let the body, read into the body. Is it kind of good pain? You can just talk to the person as well. How's that feel?
So good.
Good. Feels good. So you want that affirmation, be affirmed that it feels right, because I'll talk about it a bit. It's a language, this stuff. So I'm always aiming for perfect body work. If that's sort of attainable, I'm chasing it. So I want that that message that the person's getting, that I'm onto their blocks. I'm clearing their blocks. I'm engaging with the tissue in the manner that feels like it's really holding space, caring for it, but clearing it at the same time. So that pain that's elicited, you just know that it's beneficial. So, and that's why we go so slow as well. So you got time to receive and respond. The tissue can respond because you're holding on to it long enough for it to melt down, not be so compressed and dense. You want to spread it. So that's pretty much QL. So we might even do another spot in the heart of it as well. So this is probably more what you'd see generally people try and do. So we can go in sideways into it. And we can hit right into there like that. So we saw there was all these different, like there's lots going straight up and down, but there was other stuff kind of coming across, or sideways type of thing of that QL. So it gives you that ability to do lateral flexion as well as that hip hike type thing to shorten. So we can get right in. I can explore different angles of that.
Oh yeah. Oh yes. That's good.
So you see how the erectors are here? So they're more superficial on the top. So I can go in sideways and hit into that QL and be effective with that as well. Like that. Then what we can do, of course, I can kind of pull out of here slowly, so you can be a bit more thorough with your treatment, but just for time purposes, then you can get them up and see how it feels. So see how you feel after getting some QL work done, man.
Oh, bloody ripper. Really fell asleep. What was my test again?
Yeah, you can
that's way better. That's way better because that side feels sticky now. I just had these little kind of, wasn't bad because I was just a demo for it, but it was like just little sticky bits, and now that left side just feels so clean. I think the first thing that you did, the dynamic stuff, was just ace, but then the last stuff was just nice to enjoy. So very comprehensive, man.
You see that you're a bit wiped out, so probably just shows that some healing's happening with Aaron right now. That was intense for him, so we're just finding the spots, and that's the way healing works. You kind of, to break things down, you're stirring things up in a good way. You don't want it to be in a damaging way, a traumatic way. So then it's got to integrate. So it integrates over a couple of weeks a lot of times. So don't expect just to be, fine straight away. But that does happen sometimes.
Does happen too,
But it's like, haven't done bench for years. Go and do your bench press. You're fucking sore for 3 or 4 days, aren't you? It's like, I just lifted light.
You welcome it though, don't you? You're kind of like, it feels good to get.
Your chest's going to get better. So when you have good body work, you just know that your pain's going to go, the function's going to come back, the performance is going to be better because you're not kind of avoiding the pain, that's going on there. So that's what it's all about. So
awesome.
QL.
Just going back to as well, when you get out of a treatment only 10 minutes and you feel a bit zonked, it kind of shows how when you do fascial body work or receive fascial body work, the healing's happening on many levels, like whether it be mental, emotional, spiritual. So that's the beauty of it, and that's the beauty of remedial work, but especially fascial remedial work, is that, it's so healing. So I welcome this feeling. It's nice to drop into that state. It's beautiful. But thanks, Dean. It's good to be back on camera with the big dog.
It's
been a while.
We're back.
Might do another one. What do you think?
Yeah, let's do another one while we're hot.
See you guys.
See you soon. Thank you. Bye.